Hi everyone. So in the previous few videos we have been discussing about immunity, right? So today we will be covering a concept where what if our immune system is hyperactive or underactive? So let's start with immunodeficiency first. So immunodeficiency means your body's incapability or inability to produce adequate amount of immune cells. Could be T cells, could be B cells, or general immunity. This, you have to understand that when a baby is born, it gets the first dose of immunity from the colostrum, obviously, which is IgA, and then gradually, as and when exposures happen or vaccinations happen, the baby starts to develop active immunity. Right? Now, this whole process takes about 11 months in a baby's body. And post these 11 months, the more frequently vaccinated or exposed babies usually tend to develop a more robust immune system. However, in certain cases, there is a kind of immunodeficiency, which is the primary kind of immunodeficiency. It's known as severe combined immune disorder or SCID, right? सीवियर कंबाइंड क्यों? क्योंकि इस केस में टी सेल बी सेल दोनों का जनरेशन नहीं हो पाता, इसलिए सीवियर कंबाइंड इम्यून डेफिशिएंसी. अ वेरी कॉमन कॉज इज एडीए डेफिशिएंसी, which is an enzyme, right? Now, what happens in this case is that these babies are born without the ability to produce active immunity, right? The kind of active immunity that is acquired. Now, because of that, what happens is they start falling sick very early on. And gradually they are not able to cope up with the exposures that they face in life, and therefore these babies usually don't live for very long. Now, coming to secondary kind of immune deficiency, this is a factor mediated immune deficiency. So it can be due to malnutrition. So for example, a person who does not have a very balanced diet, not enough minerals, vitamins, because all of these immune cells, for their generation, there is requirement of these vitamins and minerals, right? All of these, like we have just come across the COVID zone, right? So we were saying that COVID affects more, the effect of COVID is more on people who are immunocompromised. So immunocompromisation happens. Obviously, in this case, it will happen. Other than that, it will happen in people who are malnourished, who have any chronic disease. So that can be diabetes, that can be a lymphoma, a cancer. So in all of these cases, the body is not able to cope up with additional infections because you do not have enough nutrients, or your body is already busy fighting some other disease, and that is known as primary immunodeficiency. In both these cases, sadly, SCID is not treatable, it's not curable. It is actually, there are no such medications, but stem cell therapy actually works, right? So if you want the details of how it is done, you have it in genetic engineering, then we can make a video on it. Let us know in the comments. But as of now, then without stem cell therapy, severe combined immune disorder is difficult to treat. There's a very good film called The Sky is Pink, which talks about this disease. It's about a girl. It's a real story, so you can go and watch it as well. And secondary kind of diseases, immunodeficiency diseases, can obviously be helped with supplements, immunogenic supplements, or vitamins and mineral supplements, which kind of help in enabling your body to better cope with the disease, right? So for example, during COVID, we were given vitamin D, vitamin B12 supplements to have, whenever you went to a doctor, they would prescribe those to you just to boost up your immune system. Okay. Now that's immunodeficiency, so it's underperformance of your immune system. Now what if your immune system is overperforming? As we discussed, acquired immunity or B cells and your T cells have the ability to recognize between self and non-self, right? So what if your body loses the ability to recognize self and non-self? In that case, it will start affecting your self cells, right? The cells of your own body. Now there can be genetic factors to it. It can be hereditary, it can be inherited from the parents, or it can be environmental as well. So exposure to certain drugs, certain chemicals can lead to autoimmunity in an adult life as well. What you have to understand well are the diseases, right? So depending on where the cells are affecting, you have Addison's disease, which affects the adrenal cortex. So obviously there is going to be, the adrenal cortex cells are going to get destroyed, and therefore there is going to be atrophy of the adrenal cortex, and therefore less generation of hormones of the corticals, the cortical hormones, right? The corticoids. Diabetes mellitus type 1. Diabetes mellitus, which we very commonly know as blood sugar, can be of two types, type 1 and type 2. Type 2 is a lifestyle disorder. Excess weight or overeating of glucose or sugar in your system can lead to diabetes mellitus type 2 because it gradually causes insulin resistance. Again, it's a topic that you have in detail. We will cover it in a video going forward. However, diabetes mellitus 1, that can be autoimmune in nature, where the beta cells of the islets of Langerhans are destroyed by your own cells, and when that happens, your body obviously cannot produce insulin and you have DM type 1. Graves' disease is when thyroid is destroyed or thyroid is attacked. In that case, you will have less thyroxine production and therefore metabolism will be hampered. Multiple sclerosis, the myelin sheath of your neurons will be attacked. In this case, what happens is there is loss of precise motion, right? So not the whole range of motion will be lost, but precise motion. That's precise motion is if I want to really reach my eye or my head, that is a precise motion. Even more precise, if you want to pick something, let's say something is stuck on my finger, I want to pick it, all of that is precise motion. So that preciseness of the motion is lost. Multiple sclerosis, myasthenia gravis, usme neuromuscular junctions are affected. What happens is that in this case na IgM complements, they all cluster up because they are mutants, and they go and sit in these neuromuscular junctions and eat away those junctions, and therefore there will be joint pain, immobility in the joints, all such problems, right? Lupus may, the overactive immune cells can attack multiple body parts. The kidneys, in that case you will need a kidney transplant. The brain, that becomes quite tricky. The organ systems, if it is the enteron, there are multiple levels of treatment depending on which organ is getting degenerated. A very common reason of this autoimmunity is T cell imbalance. As I had told you, there are TCs, THs and TS. T suppressor suppresses the TC, TH encourages or helps the TC to work, and TC kills cells. So if in the system you have more suppressors, your T cytotoxic is kept in check. But if for some reason there is less suppressors and more helpers, then this tends to become overactive and starts killing random cells. So T cell imbalance have been found upon recent research to be a very big contributing factor in autoimmunity. So there are multiple treatments that we can go for. Immunosuppressants is a good idea. So corticosteroids are orally prescribed or injected to give you immunosuppression. So your whole immune system will be suppressed. For example, patients who undergo transplants are given immunosuppressants so that the body doesn't reject the new organ. Similarly, plasmapheresis. In plasmapheresis, what is done is that the blood is taken out of the system, the plasma is separated, autoantibodies are killed, the blood is put back into the patient's body. That way, periodically, you can keep a check on the amount of autoantibodies that is present in your body. T-cell vaccines and monoclonal antibodies have also been widely used to treat obviously autoimmune disorders. I hope this much was clear. We have almost come to a close of the concepts of immunity. If you have any questions, you can drop it in the comments. We'll see you again in the next video. Thank you.